All right, so hi, I'm Christina Meucci. I'm the owner of the Recovery Room, where we do holistic sports medicine. Recovery doesn't just have to be about preparing for the next hard task. Recovery can be about repairing that ankle sprain or healing your lower back injury, and really can come in a multitude of different ways. We can do hands-off experience or a self-guided where you're worrying about flushing those legs after a really long run, or using the sauna to help reduce toxins, or using the cold plunge to help anxiety or decrease inflammation. But I see a bunch of different types of athletes. We work with marathon runners or athletes locally that are trying to become elite athletes and Division I players. We work with total knee replacement and patients with lower back pain that are just trying to run around with their kids in the backyard. We work with police and fire rescue. We work with veterans. We do give them a discount, just trying to keep our community and county safe. So even though someone may think of recovery as just for athletes, we really have a purpose and a goal of trying to make you feel your best so you can do your best, whatever that may be. I actually got started doing this in the Division I world, and it's very transactional. It was get those athletes healed so we can get them back to sport quickly and safely. But it really was very fast-paced. Then I transitioned into the hospitality industry and offered sports medicine to the luxury clientele, where we were seeing them for a short period of time, and I wasn't really being able to see all the good work that we did later on. So when I opened this place, it was really to be able to offer a bleed of both of those to our local community, so that we're bridging the gap between hurting your ankle and not knowing what to do, or having that lower back pain and not knowing if physical therapy is appropriate. So we kind of offer that collaborative effort between massage therapists, physical therapy, maybe the orthopedic that you see, and giving you a little bit of guidance and education on how to get to where you want to go. That may be we do hands-on treatment in the back with cupping or dry needling or maybe some shockwave or laser. That may be I talk to the physical therapist you're already working with, to make sure that we're also incorporating some soft tissue work while they're doing your exercises and getting ready for sport. Maybe it's you come in and do a self-guided membership or a day pass with the sauna and the cold plunge or the Normatec compression. Maybe it's healing yourself from the inside out, working with our holistic nutritionist, doing nutrition response testing, or doing a holistic recovery IV, where we're doing a vitamin and mineral infusion for immune health, or sometimes just to make sure that they feel their best. So there's many different things that the Recovery Room offers, and it's for my movers, my shakers, my athletes, and just really anybody who wants to feel their best. This is where we do our nutrition response testing. So I have a holistic nutritionist who is really trying to look at your symptoms from a different perspective. Instead of thinking about calories in and calories out for weight loss or for performance, we're actually looking at the symptoms that you have and really trying to address those symptoms so that we get to the root of your issue, which will help alleviate a lot of those symptoms like GI upset or headache or fatigue. We're trying to figure out what you have going on so you can feel your best and perform your best. She does something called nutrition response testing. So this is applied muscle testing. She will have you put your arm out and you're going to give her a little bit of back pressure, and your body is going to tell you, or really tell her, what organs may be irritated, what needs to be treated, what needs to be supported. Are you having a metal challenge? Are you having an immune challenge? Are foods upsetting you? What types of foods are upsetting you? So that you can either remove those foods, make some supplementations, and really address that root. Can be very helpful for my athletes who maybe are really controlled and intentional about what they put in their mouths, but maybe the quality of those foods aren't great. So she'll address that. Maybe we have somebody who has some type of syndrome or condition like Hashimoto's or a thyroid condition, and they need a little bit more help in selecting their foods or supporting their insides. So she'll use different vials. She will use other tests for viruses and things. She'll put them on your belly, and then she'll test your arm and see if what your body tells her. From there, she may offer some supplements that we do offer inside the office, or she may give you some suggestions on foods to stay away from, or maybe foods to add that are going to be the most helpful for you to heal from the inside out. Let's take a look at some of our recovery IV that we also use for healing the inside out. So we're here in the recovery IV portion where our nurse practitioner will take an intake and make sure that an IV is appropriate for you. But from there, make sure there's no contraindications. But from there, they're going to put an IV in, they'll hook you up to the bag, and we do a couple of different types of IVs. First one we do is a performance and recovery. So this is really geared towards tissue repair, allowing that body to shed some of the cells that aren't providing a resource for you anymore, and really making sure that you're hydrated so that those cells can continue to repair. The other is doing an immune boost. So we're really focusing on vitamin B, vitamin C, glutathione, minerals and vitamins that we need to help with your immune system and give it a boost, especially as we come into our cold season. So actually, we have these IVs as a pop-up event. So one Saturday, usually once a month, we'll have a whole day available for people to come in and do IVs. So we can do up to 4 at a time. And the biggest goal is really trying to heal them again from the inside out. Give them hydration, give them the vitamins, give them the minerals that they need for those cells to repair, regenerate, so that again, you can do the best that you possibly can. So we are in the hands-on recovery treatment and sports medicine assessment area. So this is my domain. This is where my athletes or my movers and shakers may come back to me, and we'll sit in a chair during our first assessment to really get a good understanding for their medical history. Make sure that none of the treatments that I do are contraindicated. Make sure that they're appropriate for what they've got going on, and really lay down the land and educate them on here's what your assessment findings were, here are the different types of treatments that are going to be very helpful, and here's the best course of action I think we should take right now. We're going to go through a couple of those different treatments, but one of the biggest goals that I have with my patients is transparency. It's letting them know that my hands can be in the pot of their treatment plan, but if they have other providers, I want to collaborate with them. I want to reach out to their physical therapist or their massage therapist or their acupuncturist and figure out what are they offering. Let's make sure we don't overdo with that modality, and let's make sure we're always adding something that's going to be helpful rather than in competition with another type of treatment. The other transparency is I always want my patients to be transparent with myself to make sure that the treatment that we're offering them is bringing them relief, and not just coming in and receiving that treatment because that's what they think is the best course of action and they don't want to deter from that. Deterring from a treatment that's not bringing them help or bringing them relief or improving their symptoms is actually not helping them at all. So transparently, we talk about their symptoms every time they come in. They may not like the Graston or hands-on muscle scraping. They may not like the cupping. They may not like any needling. We may have to do in transition to shockwave or laser or doing something like blood flow restriction exercises. So those decisions actually don't just get made by myself. I think here are all of our treatment options that are indicated or appropriate for the injury you have at hand or the ache or pain you're feeling. And now you get to decide and your body gets to tell me what feels the best, what's alleviating those symptoms the quickest. So let's go through a couple of those that I do as options for my patients. First one is something called muscle scraping more traditionally known as gua sha in the traditional Chinese medicine realm. I actually don't do gua sha, although that's where the research started. We do something called Graston technique. So we're going to take this tool, we're going to put some cream on the skin, and we're going to essentially brush that tool on the skin. Maybe we might hold a spot and do some trigger point work, or maybe we don't use it at all. Sometimes when we do Graston technique, I may need to use or add another tool to my tool. Snap that in. And now I'm actually using these little combs to try to decrease the pain that they feel in that space before I even go in with a little bit of pressure or a little bit of local pinpoint treatment. Sometimes I need to just tell their body, this is safe and this feels good. That's Graston. The next one that we might do is therapeutic cupping, where I'll put a cup right on that area. So if I'm working on their hand or their elbow, it might be a smaller cup, and we're going to create suction. Very similar to the Graston or even some type of manual therapy where I might use my hands. This is creating separation or decompression so that I can get that connective tissue and get blood flow really swirling in that area and help bring resource to that tissue that needs healing. Another one we might do is this shockwave. Shockwave is using acoustical sound waves. So this white portion is actually a compressor. Here's the hose, and there's a little metal bean inside here. That little metal bean moves back and forth and hits the sound head, and this treatment is really helpful for my chronic issues. Things like Achilles tendonitis, rotator cuff pain, plantar fasciitis, Achilles tendinopathy, and we're really trying to take that chronic injury and actually almost trick the body into thinking this is actually acute. Let's go through the acute timeline of healing so that we can repair those tissues faster and more quickly so you can return to the things you love to do a little bit faster. After shockwave, another option is laser. Laser can be helpful for really pretty much anything. Acute injury like a fracture or an ankle sprain, where the main goal is reduce my pain, heal that tissue. Or for my chronic injury, where they're having discomfort, they're having inflammation, stuck in a space, they have pain or loss of range of motion. Laser uses energy or light to give energy to that cell so it can repair. It builds capillaries or builds blood flow routes to bring those resources to that area. And then it also decreases people's pain. So decreasing pain is my biggest use for laser. Lower back pain, shoulder pain, really any of the injuries that we talk about, laser is actually going to be very, very helpful. And again, we don't use laser on every single patient. We use laser on the patients that it is helpful to. Sometimes people receive the laser and they say, it's not my favorite. Let's do something else. Others, we may have started with another type of treatment like the cupping or the Graston, and they say that's not for me, and we have the ability to use laser on them. Other treatments that we offer focus a little bit more into the performance realm. After we've reduced your pain, we've improved your range of motion, maybe made you a little bit more functional. Now let's take that and move the envelope a little bit further so that now you can go and enjoy the things that you want to do. Hiking, biking, maybe it's playing a sport, maybe it's running around with your grandkids or your kids in the backyard. To be able to do that, we have to make sure we're strong enough to do that. So 2 other modalities that we offer. One is using TENS or e-stim on the needle after doing dry needling. Dry needling can be really helpful for stimulating a muscle, can be very helpful for getting your connective tissues to be a little bit more lubricated and improve your range of motion, improve your functionality. But we'll couple that dry needling with the TENS unit and try and get that muscle to fire a little bit better. If it fires, we now can do some blood flow restriction or just regular exercise. Blood flow restriction incorporates using a tourniquet or like a blood pressure cuff to limit blood flow in and limit any waste like lactic acid buildup from coming out of the limb. That can be really helpful, especially during that last phase of strengthening a tissue before you get to sport or before you are completely out of our doors, in really just limiting the resources like oxygen or blood flow to the muscle, and it's forcing it to work a little harder without having to put any external load on it, like a dumbbell or a barbell. Some patients, like osteoporosis or osteoarthritis, using a dumbbell, using any type of bands, maybe even a barbell with a squat, can be a little uncomfortable on the joints. And so to save them that discomfort, but still load their tissues, we're going to load it from the inside, and we're going to limit the blood flow in and the lactic acid out. Out of all of those things, my favorite part about doing sports medicine is being collaborative, not just with other providers, but being collaborative with my patients. My goal is to make them feel their best so they can go do their best. And I can't do that if we don't have that collaboration of them expressing to me what they feel. Even after every single treatment, it may be different. And so making sure that we are continually changing the treatment plan, if needed, to get them where they want to be. We have some self-guided modalities that we're going to talk about when it comes to performance and immune boosting and really just some overall wellness. So let's go take a look. So we do have some self-guided recovery options. Here we have a traditional electric sauna. We do have somebody in there. And really the main purpose for using the sauna is actually traditionally for longevity, to boost your immune system, to decrease your risk of stroke, to decrease your risk of cardiovascular disease or conditions. The other aspect is going to be for something called heat shock proteins. When you stress your body, the temperature can get as high as 170 to 180 degrees. When we increase the external temperature, your body has to try to cool yourself. And we actually have something called heat shock proteins that get pulled out of our system, get stimulated. And that heat shock protein helps you to build some immune resiliency. So we use the sauna, yes, for muscle relaxation. Yes, sometimes people will use it for sweating, but mainly for longevity and making sure your immune and the rest of your body is recovering really well and repairing so that we don't have those other conditions later on in life having a risk of coming in. So we're in the Normatec section where these for the legs, the hips, and the arms will blow up with air and compress your limb, and it feels like a big giant hug. The goal of this is to actually bring blood flow from the furthest part of your leg all the way back up towards the heart so that you can flush that lactic acid and the enzymes that get built up in your muscles after you worked really, really hard after a workout or a hike or a bike, and try to do a little bit of lymphatic drainage. Feels really great after my endurance athletes are running a marathon. Feels really good for my athletes who are pitchers or throwing athletes like football or lacrosse, and trying to help their body recover a little bit faster by stimulating circulation or blood flow. When we do the compression, we can also use it for after surgery. So someone who had a total knee replacement or an ACL repair, we're trying to stimulate blood flow so that we can reduce some of the swelling that sits in that joint after surgery, but we're just going to control how much pressure is in that joint. So we may have regular pressure in the feet, we may have regular pressure in the calf, but then we may modify the pressure at that knee if that's where their surgery is, and then regular pressure back up at the hip. A lot of my athletes really love to do this after exercise. But some people like to do it before exercise to get that fresh leg syndrome or that fresh leg feeling before they go for their run, or help compress their lower back because they like the pressure on their back and it makes their lower back pain feel better. So not everybody has to do it after exercise. We can actually use it just to make that leg or that lower back or that hip or that arm feel really, really fresh and ready to go. Lastly, we have the cold plunge. Cold plunge can be helpful for so many things, not just physical. I personally use it for a reduction of anxiety, a boost in mood, kind of get me prepared for my day, kind of reset my, and have some mental clarity to get ready. Other athletes will use it for reduction of inflammation and to really help with some of their joint pain. When we use the cold plunge is set to 42 degrees, so it's a bit chilly, but it does have a filter on it. We do use some chemicals in there so it stays clean, and the chiller is on 24/7, so anytime you come into the shop, it is ready to go at 42 degrees. The goal of cold plunge, to get those benefits, just like the sauna, for longevity, the immune boost in dopamine, which is our happy, have that reduction of anxiety, is to get to 3 minutes. Once we get to that 3 minutes, we have, just like the heat shock proteins, we have the same type of response in the body, and that's where we get that boost in dopamine, norepinephrine, and get all of those happy chemicals to make us feel really good. We sit in there for no longer than 15 minutes. So for some people who have done it multiple times, she can sit in here for 10, 12, 15 minutes. Others, the first time they come in, they may only be in there for a minute and a half, but the goal is to get to 3. Once they start to control their breathing, get a little bit of a meditation, that is when they start to notice they can make it to 3 or 5 or even 6 minutes. In the week, the research tells us 11 minutes a week of plunging, while the sauna is 57 minutes a week. So for our self-guided experience, that may mean someone comes in twice a week and plunges for, say, 5 or 6 minutes, and saunas for a half an hour. That may be stretched out 5 days a week, and they come in and they plunge for 2 minutes or 3 minutes, and then they only sauna for 15. But the goal is 11 minutes a week in the plunge and 57 minutes a week in the sauna. I want to thank you for joining me and seeing the beautiful space that we have here at the recovery room. We are located at 32 Bank Row, right in Park Square, right downtown in the heart of Pittsfield. If you'd like to get in touch with us, the best way is to reach us on the office phone, whether that's phone call or text message at 413-822-7882. And don't be a stranger to just pop by the shop and explore a little bit, ask as many questions as you'd like. We'd love to have you. Thanks.